Can early detection mitigate the impact of cancer risk factors? Have you ever wondered if catching cancer early can really make a difference? The answer is yes. Early detection plays a vital role in reducing the impact of cancer risk factors, especially for types like testicular cancer, cervical cancer, and other reproductive cancers. When cancer is detected at an early stage, it often leads to more effective treatment options, which can significantly improve survival rates and quality of life. One of the key benefits of early detection is the ability to identify cancers before symptoms even appear. Thanks to advances in diagnostic technologies, there are now blood tests that can find tumor-derived genetic mutations years before a clinical diagnosis. For instance, some experimental blood tests can detect cancer up to 3 years earlier than traditional methods. This early identification opens a valuable window for intervention and management. Screening programs are another crucial aspect of early detection. For example, Pap smears for cervical cancer help detect precancerous changes or early-stage cancers, which can significantly reduce incidence and mortality. For testicular cancer and other reproductive cancers, being aware of risk factors and performing regular self-examinations or clinical exams can lead to earlier diagnosis. Genetic testing also plays an important role. Screening for mutations, such as BRCA mutations associated with higher cancer risk, allows for the identification of individuals who are at a higher risk. This enables personalized surveillance and preventive strategies, enhancing early detection and tailored treatment. When cancer is diagnosed early, it typically means that less invasive and shorter treatments are needed. This increases the likelihood of a cure. On the other hand, delayed diagnosis often leads to advanced stage cancer, which is much harder to treat and generally has poorer outcomes. For specific cancers like testicular cancer, early detection is critical. Self-examination and clinical evaluations can lead to a diagnosis when the disease is still localized. Survival rates for localized testicular cancer exceed 95%. In the case of cervical cancer, regular screenings can identify precancerous lesions. Treating these early can prevent progression to invasive cancer, drastically reducing mortality rates. Other reproductive cancers also benefit from early detection strategies. Methods such as pelvic exams, imaging, and genetic counseling help identify cancers of the ovaries, uterus, and prostate at an early stage, improving the chances of successful treatment. However, while early detection is beneficial, it is important to follow up with appropriate treatment. False positives and overdiagnosis can cause unnecessary anxiety and interventions. Access to screening can also vary, affecting early detection success, especially in underserved populations. In summary, early detection significantly mitigates the impact of cancer risk factors by identifying cancers when they are more treatable. For testicular, cervical, and other reproductive cancers, established screening methods and genetic testing enhance early diagnosis, leading to better outcomes. It is crucial to ensure equitable access to these tools and appropriate clinical management to fully benefit from early detection. Always consult healthcare professionals for personalized advice and guidance.